Thank you. So good morning, everybody. I'm very happy actually to participate in such an excellent conference. I would like to present our paper, which is the Bethesda System for Reporting Thyroid Cytopathology, a retrospective review of its diagnostic utility at Johns Hopkins Aramco Healthcare in Saudi Arabia. Actually, our paper has been published in American Journal of Otolaryngology. So beginning with the introduction, thyroid nodules considered to be as common as 5% of general population by palpation and up to 50% by ultrasound. FNA has a golden role in thyroid nodules evaluation due to its cost effectiveness and accuracy. The Bethesda System for Reporting Thyroid Cytopathology was created in 2007 to categorize and predict the malignancy risk of the different types of thyroid FNAs. Since that time, only few studies were performed in Saudi Arabia to assess this system's validation of whether the malignancy rates reported in this system might be applied to Saudi population. So our main objective of this study was to report the diagnostic utility of Bethesda System at our institution and report the malignancy risk for FNA of thyroid lesions among our patients at the Johns Hopkins Aramco Healthcare, Jaha Hospital in Dhahran, Saudi Arabia. So our methods, it was a retrospective study comparing the FNA categories with the final histopathological result for all patients with thyroid nodules who underwent thyroid surgery for a 4-year period between January 2016 to December 2019, performed at Jaha in Dhahran. All FNAs and histopathology specimens were collected and studied, then reported at Jaha. Our selection criteria included all patients who had thyroid FNA in Jaha, followed by thyroid surgery, including either lobectomy, subtotal, or total thyroidectomy, with post-operative histopathology results between the previously mentioned period. And also included all patients who had thyroid FNA outside Jaha, and the slides were reviewed and verified in Jaha in the same period. We excluded patients who underwent the surgery outside Jaha, or those who performed the surgery by another specialty rather than otolaryngology. And also we excluded patients with unavailable full records for them. Cytopathology specimens were classified according to the Bethesda System, the well-known 6 categories from non-diagnostic, benign, FLUS, follicular neoplasm, suspicious for malignancy, and malignant category. After that, the histopathology results were correlated with the cytology, with the FNA results, to calculate the malignancy rate among each category. And if we find FNA result in the same, more than one FNA result in the same procedure, only the diagnosis with higher potential for malignancy was considered. Then after calculating the malignancy rate for each category among our study, we compared our results with the published Bethesda System to determine whether our study validates the diagnostic reproducibility of this system and yields similar results using Fisher's exact test, considering a p-value of less than 0.05 as a statistically significant result. So then we come to the results. Among all 285 patients who underwent the thyroid surgery between 2016 to 2019, 241 patients met our inclusion criteria. Here we can see the overall distribution of the FNAs in our population. The most common FNA category was the benign category, followed by follicular neoplasm, and then the malignant category, and then the FLUS category. only minimal were suspicious for malignancy or non-diagnostic. And here we can see the distribution of the final histopathological results after the thyroid surgery. Up to 60% of our population came as benign histopathology, and the second most common was the papillary category. And here we correlated the FNA results with the final histopathological results to calculate the malignancy rate for each FNA category. And results came as this. The non-diagnostic FNA category, it had a malignancy rate of 25%. The benign FNA came as 18% malignancy rate. The FLUS was 37%. Follicular neoplasm was 38%, and suspicious for malignancy, it was 100%, and the malignant category was 95%. So by statistical analysis of JAHA study results correlating FNA with histopathological results, it was found that our study validates the diagnostic reproducibility of the Bethesda system and yields similar and comparable results for risk of malignancy with a p-value of less than 0.001. Therefore, our results are considered statistically significant, and we are not deviated from the Bethesda system score. Here, you can see the comparison between our malignancy rate for each category, as I mentioned just now, in comparison to the published malignancy rate in the Bethesda system. It is comparable in most of the categories, but we can note here in the benign category, it is as high as 18% in comparison to the published, which is only 3%. And also here in suspicious for malignancy, it has been 100%, while in the published Bethesda system, it is only up to 75%. And I will explain and come through this in the following slides. Here just another illustration of the comparison between our malignancy rate and the published malignancy rate. So our findings validates this system for Saudi population, being consistent with data previously reported internationally. There was a high agreement between the risk of malignancy based on FNA in malignant category and on histopathology of 95.1%, underlying the power of Bethesda system in clinical practice. However, we did identify some discrepancy between our results and those previously reported. As I mentioned, in benign category, it was as high as 18%. This could be attributed to the large number of micropapillary carcinomas, which is defined as a papillary carcinoma of less than 1 centimeter size, which were incidentally identified on final histopathological specimen. And they were 8 cases out of total 13. After excluding these cases of micropapillary carcinoma, the malignancy risk decreased to only 5%, 5.7%, approaching the previously published malignancy risk. This difference is important to note due to the significant impact on management and prognosis. Also in suspicious for malignancy, it was 100%. This is mainly attributed to a very low population in this category in particular, where we had only 3 patients included in this category. Limitation of our study. We did not use the meta-analysis to expand the sample size even more and compare the results with other institutes in Saudi Arabia, but we are planning to do this in the future, hopefully. Regarding the ultrasound-guided versus direct FNA, although both methods were included in this study, we did not compare the accuracy between each method. Regarding the sample size, although it was adequate overall, there was underrepresentation, particularly in the suspicious for malignancy category, where we had only 3 patients, and this may have contributed to the discrepancy in the malignancy risk. So to conclude, this was a retrospective study of FNA thyroid lesions among JAHA patients using Bethesda System that validates the diagnostic reproducibility of the system and yields similar results for risk of malignancy as reported by international standards. We recommend in the future to do meta-analysis for further information and to compare the ultrasound-guided FNA results with the direct FNA results. These are the references, and thank you so much for the attention.